Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving into a fascinating and often challenging condition in our canine companions, extrahepatic portosystemic shunts, or EHPSS. For years, the general understanding has been that these congenital shunts, which are abnormal blood vessels bypassing the liver, are primarily seen in smaller breed dogs. The good news is that surgical management of EHPSS in large dogs showed similar short-term outcomes to those in small breeds. Short-term complications such as vomiting, diarrhea, and lethargy occurred in about 38% of surgically treated dogs. Critically, the shunt-related mortality rate for surgical management was just under 7%. This is comparable to, and in some cases even lower than, the 2 to 27% mortality rates reported for surgically treated small breed dogs in established literature. Revision surgeries were performed in a small number of dogs for the 45 due to persistent clinical signs indicating the complexity of some cases. A significant positive outcome of surgical attenuation was the ability to reduce or even discontinue medical management. At the 90-day follow-up, 37.5% of surviving attenuated dogs were completely weaned off medications, and another 15% were maintained only on a liver-specific diet. This stands in stark contrast to the medically managed group, where all dogs remained on their original shunt-related medication regimens. And speaking of the medically managed dogs, the 18 dogs who did not undergo surgery, 22% experienced documented shunt-related deaths within the follow-up period. While limited by the smaller sample size, the study's Kaplan-Meier survival analysis showed a clear difference in long-term survival. Surgically attenuated dogs had a survival rate of 89% at 1 year, and 77% at both 7 and 5 years. In contrast, medically managed dogs had an 82% survival rate at 1 year, and it dropped off significantly to 49% at 2 years and only 24% at 5 years. This really highlights the benefit of surgical intervention for long-term prognosis in these large breed dogs.